All right, you guys. Hello, hello, and welcome to you. Welcome to Jessica, Dr. Jessica Drummond, who is a friend of mine and a mentor, someone I truly, truly look up to, and I'll tell you why in just a second. But we're going to be talking about really cool stuff today, including the gut microbiome, bladder pain. So anybody with interstitial cystitis or even chronic yeast infections, you're going to want to listen up to this one. And we're also going to talk about chocolate. So, I mean, this is really something you don't want to miss. Jessica is the founder of the Integrative Women's Health Institute. That is the place that I went for my my certificate in women's health and nutrition coaching. So I went through Jessica's program. I loved it. I learned so much. And I want to introduce her to you today. So Dr. Jessica Drummond is a doctor of clinical nutrition and a physical therapist. Like I said, she's the founder of the Integrative Women's Health Institute, and she is passionate about empowering women who struggle with chronic health conditions, including chronic pain and pelvic pain. So I'm going to let Jessica fill in the blanks and tell you a little bit more about Jessica, if you can tell people how you got into this work and a little more about your background, that would be great.
Excellent. So good to see you, Brianne, and thanks so much for having me. I'm looking forward to this conversation. And yeah, so the Integrative Women's Health Institute came out of kind of a progression of my career. So I worked as a physical therapist in hands-on pelvic floor rehab for about 12 years before I started meandering into nutrition and health coaching. My oldest daughter was born in 2003, and I had my own hormonal crash, as I'm sure many of us can relate to. I was fatigued, I was anxious, I was getting sick all the time, all these vague complaints. But they were quite severe. I mean, there were days where I literally could not get out of bed, and my doctors were all like, oh, just take some antidepressants, or you probably need a nap, or, all this kind of thing. And I was working at very skilled hospitals when I was going through this myself. And finally, through that path, a few years later, found functional medicine and started to bring functional nutrition into my practice in women's health, because women with chronic pelvic pain have such complex and diverse and challenging issues. It's pretty rare that you have a simple, straightforward case of chronic pelvic pain. If you have bladder pain, sometimes you also have sexual pain. If you have pelvic pain, sometimes you also have chronic yeast infections. So, I knew that this approach could really help these women, because it helped unravel all of these things that there was no one specialist who was able to help me with.
So by the approach you're speaking to is the functional nutrition approach, the kind of holistic approach. Is that correct?
Yeah, so it's taking, certainly my Western trained brain, and we look at all the research, and, hands-on physical therapy is extremely valuable, and movement therapy and fitness, and then combining that with a root cause approach to nutrition. So it's not just kind of band-aiding things with supplemental bioidentical hormones or what's the right supplement for that symptom. It's much more about let's optimize the functioning of women's digestive systems, of their immune systems, of their hormone systems. And doing all of that combined with the musculoskeletal work and just lifestyle medicine, things like sleep. And as you say, move every day, eat clean, like really simple things are so powerful and so underappreciated by, the sort of general Western medical community that's always looking for like, what's the magic bullet pill or surgery or test or supplement or food plan. It's really a different approach. It's saying, how do we help this woman be as healthy as possible in her current situation so that the symptoms start to just melt away? And that's what happened in my experience. So that's the approach that I bring now.
I love it. I love it because you're not just chasing symptoms throughout the body. You're addressing the whole person, which really, as you said, lets things just kind of fall into place and, melt away. Now, you must have been looked at by you were potentially looked at by some people in the medical community as a little bit crazy, because you were one of the first ones, I feel, that really got out there in the physical therapy world, which is a very Western approach, with this very integrative, holistic approach and really focusing in on nutrition, is that one of the reasons you created your school, your online training program for, healthcare professionals?
Absolutely. Yeah. I mean, I definitely got a lot of criticism at first and continue to do so, but it's less now. And some of the people that used to critique me have since, sort of invited me to teach, because there's a lot more, the research has started to catch up, especially about in this area that we're going to talk about today, the gut microbiome. When I was first dealing with this, 2003, 2006, and I was talking about how nutrition could impact pain and fatigue and anxiety. Literally all of my colleagues thought I was nuts. Some of them intuitively thought it made sense, but then they're like, well, what do we do? And I don't know anything about this. And this is kind of crazy and scary. And if it's that simple, why hasn't my doctor told me this already? Those kinds of things. But yeah, I mean, I think, the research is definitely catching up to this functional and integrative approach being really the best practice strategy now that we have for especially these complex chronic conditions. I mean, certainly, if you break your arm or, you have an episiotomy and you need it sewn up, like there are things where we have, maybe you didn't need an episiotomy, but maybe you did. There are certain times when really specific kind of Western tools are very appropriate. And I've never sort of fought against Western medicine. I really just think that if we have simpler tools that we didn't think could possibly work, but actually do, and are very low risk and low side effects and all of this, the side effects in fact are benefits rather than negatives, let's bring that into play. It's just, I think that my colleagues just didn't really think it could possibly be that simple, because the way we were trained is that, it's like the testing has to be complicated and you have to find, exactly which joint is out of place and these kinds of things, which we now really understand it's the wrong way to look at it.
Yeah. Oh, love you. You speak my language. So we're here today to talk about bladder pain, and maybe interstitial cystitis is a big word that a lot of people who are watching probably know because they may have been diagnosed with that condition. But for those who are curious about bladder pain and different causes of bladder pain, can you maybe address some of those causes and types of issues? And then also, I want to move into the gut microbiome and what that is as well. So go for it. What are some causes of bladder pain? And
interstitial cystitis is a diagnosis where the urogynecologist will put a cystoscope into the bladder and look for inflammation and little red, irritated and possibly damaged spots of the bladder lining. Now, the cause is sort of up in the air, but that's sort of how you would have it diagnosed. It's also just called painful bladder syndrome. We distinguish it from other things when, for example, the patient doesn't have a bladder infection, that's cultured. But certainly chronic UTIs and chronic yeast infections and chronic bladder infections can predate, symptoms where maybe someone's had a lot of antibiotic treatments for these various, or antifungal treatments for these various chronic infections, which some of them I think of as, true infections. Others are really more dysbiosis, which is kind of an imbalance between the healthy and the unhealthy bacteria that are supposed to be there. These areas are not necessarily supposed to be sterile. They're supposed to have bacteria, but they should be in balance. And so they've had a lot of treatments. Maybe the cultures are still coming up negative, but they still have bladder pain. They still have urinary urgency and frequency, nighttime urination. So it's very quality of life disrupting. And it can often overlap with other common chronic pelvic pain conditions, for example, endometriosis. And there certainly could be endometriotic growths, in or near or around or near the bladder, which can be very irritating as well.
Yeah, so I mean, it's sometimes even what came first, what caused what, kind of a chicken or the egg type of thing. It seems that so often you have one thing going on which causes a cascade of events, and maybe even other conditions come on board. So I know that when I was in the clinic, when I was seeing folks with interstitial cystitis, they would come to physical therapy because they had such terrible musculoskeletal pain because of the flares that would happen. I think one of the hallmarks of interstitial cystitis is kind of flares of pain that come and go and can really make your body just tense up because you never know when that flare is going to come. And then when it does come, it's very painful in the bladder area. But same thing with chronic yeast infections. Those can be very painful. And any condition, certainly endometriosis too, but everything in there just gets really painful. Your body gets tense, and then that's one time that physical therapy may be warranted for these issues. So for anybody watching, please, listen to this information about the gut microbiome that we're about to share, but also consider that seeing a women's health physical therapist is a great option too. Someone who can work with the musculoskeletal reaction that your body has to the pain.
Yeah, definitely. And I think that's one of the most challenging things about all pelvic pain conditions is that, we have this neural crosstalk, nervous system crosstalk. So I think of the pelvis as this bowl, this coming together of many systems. The outer, kind of support for this bowl is the pelvic floor, the hip myofascia, the joints of the, pelvis and the lumbar spine and the hips. So any of these muscles and fascia and nervous system involvement, talking about just muscles and nerves and joints, can worsen the whole situation because of that kind of walking around tight, right? It's the same thing. We used to, the first analogy we ever had for pelvic pain was headache in the pelvis. Yeah. And it's like women who are walking around like super stressed and their ears are like this. And it's not really that their head is injured. It's that their neck and shoulder muscles and chest muscles are so tight that it's referring pain to the head. Yeah. And then inside the pelvic bowl, we've got the digestive system. So if you have IBS or inflammatory bowel disease or constipation, or, I've had a couple of patients with various kinds of pelvic pain who had inflamed appendix that weren't out for, took a while before they were taken out. So, the colon is in there and it's making noise if the digestive system is not happy. The bladder can be irritated. And, we talk a lot about leaky gut in kind of functional nutrition because most of your nutrients are absorbed in the small intestine, and the small intestinal lining acts as like an internal skin to keep bacteria and undigested food and all kinds of other junk medications and things from crossing that barrier and inflaming the immune system generally. And there's some discussion among sort of the integrative medicine perspective that interstitial cystitis is similar, but it's leaky bladder. The lining of the bladder is irritated. And so what we have to think about is, well, how is that related to immune health? So you've got this, you've got constipation or IBS, then you've got this irritated bladder lining, then you have constant chronic yeast or UTI, yeast infections or UTI. So that's a imbalance of the healthy and unhealthy bacteria in the vaginal canal and potentially surrounding, the urinary tract. So it's like we have to unwind all of these systems rather than just trying to numb the bladder, for example. Yeah. We want to get all of these systems healthy because otherwise they're going to keep talking to each other and flaring each other up.
Yeah, I love that. And even rather than just giving somebody a couple of stretches too, again, it really all needs to work together. So speaking about the gut microbiome, which means little world, correct?
Yeah, well, you think of inside the colon, we actually have this entire ecosystem of bacteria. There are far more bacterial cells and genes, far more, in multitudes more of bacterial cells and genes in our body than human cells and genes, which is fascinating because we thought this was all going to be related. We sequenced the human genetic genes and we thought that was going to be so telling. We found out human genome is no more complex than the genome of a Chardonnay grape. However, we are clearly, well, some of us, I guess, more than others, are clearly more, complex than a Chardonnay grape, right? Maybe. I mean, I guess that could be argued, right? But theoretically, we're all pretty complex.
You've got the wine lovers out there who are saying, excuse me, Jed, that is not true. Highly
Right.
complex,
I mean, maybe
the
not.
Chardonnay grape.
That's right. I didn't grow up in Napa or anything, so I could be wrong about this. But our gene expression, however, while there's a lot of inputs to that make a difference, we've got nutrigenomics, how we eat expresses our genes differently. But one of the biggest things that impacts our genetic expression and our epigenetics is the gut microbiome. So this is this whole community of organisms that, for the most part, lives in our colon, our large intestines. And we want to keep that ecosystem healthy, because anytime we get kind of vulnerable, that our humanness gets vulnerable, that the bad guys living in that ecosystem thrive. Unfortunately, that ecosystem is not out to protect us necessarily. It's out to kind of take over if we are weak. So we have to manage the health of that ecosystem. And unfortunately, it's not really as simple as saying, oh, just take probiotics, right? Because probiotics are the good guys. We want more of them. But we don't yet know exactly the perfect composition, number of species that we want in there. So, and also you may have, different strains of probiotics are beneficial for some things versus other things. So when I think about what are probiotics, and probiotics, these bacteria are extremely different from each other. So some of the ones you might have heard of, Lactobacillus acidophilus, that's a really common probiotic that's in yogurt, like commercial yogurt. And then you might have Lactobacillus plantarum, right? So they're both, let's say, in the cat family, if we're going to make an analogy here. Okay. But one's like a little house cat and one's like a lion, right? So they might be different. You might take them for different reasons, different times. And Bifidobacterium and Saccharomyces, these are extremely different. These are different, from Lactobacillus as cats and dogs, or cats and, elephants or something. And so we have to really not just throw probiotics at the problem. We have to think about how to nourish this whole ecosystem of healthy bacteria that live in our colon. The number one way to do that is to eat food that encourages the growth of, that feeds a diversity of healthy bacteria. Primarily plant-based. You want to have about 8 to 10 servings of vegetables per day. Healthy fats, clean proteins, can be animal proteins, that's fine. But, not a lot of processed grains, not a lot of sugar. So unfortunately, the not so good bugs, the pathogenic bugs, thrive on things like cake and candy and soda and diet soda, So that is not good. But if we feed this ecosystem with a diversity of vegetables and healthy fats and clean proteins, just starting with that simplicity, then the healthier bacteria tend to thrive and keep the other bacteria in check. Now, if everything's already out of balance, so for example, you've already got bladder pain, you've already had tons of yeast infections, maybe you're bloated. There's an interesting study. So SIBO, I'm going to get a little technical here, but let me try to keep this simple. SIBO is when I told you that most of this ecosystem lives in your colon, and that's where it should be. Sometimes these bacteria creep back up and live in the small intestine. Remember, I told you the small intestine is where most of our nutrients are absorbed and where there's this barrier to keep our immune system from having to deal with all kinds of stuff, bacteria, undigested food, and so forth.
This was the internal skin that you referenced. I love that. The internal skin.
Right. So inside the small intestine, there shouldn't be a lot of bacteria, because any food we eat, we want to get mostly absorbed in the small intestine. And if there's lots of bacteria in the small intestine, those bacteria are going to eat the food that was meant for us and ferment it. So you're going to have this little brewery going on, or, wine making cask or whatever. We're going to stick to that analogy, in your small intestine. So if you get bloated within about an hour to an hour and a half after eating, that's a red flag that you've got too many bacteria. Even if they're the good guys, even if they're probiotics, they shouldn't be living in the small intestines. And you have too many bacteria living there. So, and what's interesting about that when we're talking about bladder pain is there was one study done where people who had interstitial cystitis, painful bladder syndrome, who also had any kind of GI complaints, constipation, diarrhea, abdominal pain, bloating, things like that, if they were treated for small intestine bacterial overgrowth, SIBO, about almost 50% of them, their bladder pain also went away.
Wow. Wow, that's really interesting. So I have a question here. Would it be fair to say that problems with the gut microbiome and imbalance could cause bladder pain issues, and or bladder pain issues could be that stressor that can cause an imbalance in the gut microbiome? Like, could it go either way, potentially?
Yeah, theoretically. I don't think we really know enough about what causes what.
Okay.
But certainly that they irritate each other.
Yeah.
And so it's easiest, in my opinion, to start with optimizing digestive function, because as you do that, then every time the person eats more and more healthy stuff or takes healthy nutrient supportive supplements, those things are actually helping the other cells heal because they can get to them.
This is perfect, because I wanted to ask you next, what are some basic things that people could do if they think, gosh, okay, I probably have some kind of imbalance. I have bladder pain. What can I do? So could you share kind of maybe a first step that people could work on at home before they find a provider that could help them out?
Yeah, I think, well, I would keep in the back of my mind, if you are experiencing that early bloating or post-meal bloating, I would definitely kind of start looking for a functional nutritionist or a functional medicine practitioner who can test you for SIBO. It's a breath test. It's non-invasive, but that would be one thing I would be looking for. Those tests are not perfect, but we don't really have time to get into why, but they're really helpful. And then we always start with pelvic pain with a very gentle, nourishing elimination diet. And elimination diet just means we're going to feed you all the good stuff as much as possible. There's no restriction. You're not on a diet, but we're just taking 3 weeks to rest the digestive system of things that we know feed the bad bacteria and, tend to cause food sensitivities and things like that. So keep your nutrition plan to mostly vegetables. Now, this is a little tricky because if you do have SIBO and you're eating a lot of cruciferous vegetables, you might be even more bloated in the short term. But, hopefully after a week or so, that will start to resolve. But and you can also cook the vegetables, put them in smoothies, make sure you're chewing at least 40 times per bite, slow down the meals. But if you're eating tons of big salads that are raw, that could make you feel worse. So think about your digestion. If it's already irritated, let's cook down the vegetables a little bit and chew them well. So vegetables, some low glycemic fruits, things like berries and stone fruits are great. Pears, cantaloupe is another good one. And then clean protein. So if you are a vegetarian, you can certainly use beans and whole cooked or slow cooked whole grains. So soak your rice, soak your beans, cook them slowly so that we get rid of some of the things that tend to irritate the digestion. If you're a meat lover, that's fine. Get the healthiest possible meats and fish that you can find. Grass-fed, pastured, organic, wild seafood, things like that. And then for fats, you want to focus on avocados, coconut oil, olive oil, nuts and seeds. And that's where I would begin. And you can have a very healthy, delicious, diverse diet with all of those foods.
So you're cutting out essentially the gluten, the sugars, the dairy, and the soy.
Yeah, soy. Probably those 4 are the key. Eggs are irritants in some people. And then if that's not enough, we do need to fine tune sometimes. If you have interstitial cystitis, sometimes we need to look at oxalates. Sometimes we need to look at vinegars and lemon juices and spicy foods. Sometimes we have to look at nightshades. Sometimes we have to look at legumes or grains. So it can get a bit complicated, but if you take that first step, and just start getting your diet cleaner, start taking really good care of yourself. Sleep is essential to healing. Getting to bed at 9:30, trying to go to sleep by 10, less exposure to blue light, more exposure to nature, hydration, filtered water. And then if you also are experiencing symptoms of yeast infections or UTIs, have them cultured so that we know if you really are dealing with a specific microorganism like Candida or something like that, or if not, and then there are specific probiotic strains that have been studied, that we can use if you're not having, whether you are or not, to get those things in balance. So it's a little bit, it would be easier in concert with a nutritionist, but that first step of making the decision to take ownership and start taking care of yourself is really, really helpful, because then we can just walk through the systems. If that nutrition plan is not enough, it's about fine tuning rather than being like, oh my God, that didn't work.
Yeah.
Yeah. And if that probiotic strain didn't work, okay, let's fine tune. Let's see which one is the right one for your body. Yeah. It's not to say that it's like, try this, it's going to work, or it's not going to work. Yeah. It's a little bit of a exploratory journey.
And I love that great, simple first step that, like you said, it is an elimination diet, and it is, as I said, eliminating some of those common food groups. But you shared all the wonderful things that you can eat, and just taking control of your health by starting with that simple step of, for 3 weeks, I'm going to eat these very basic foods, and it's going to be nourishing, and I'm going to just clean things up and see what happens. And I know one of the foods that's really, really great for leaky gut syndrome and healing the gut is bone broth, where you, if you're not a vegan, where you simmer down bones from like a chicken bones or beef bones and simmer them with vegetables and water just overnight. It is so good for you, so nourishing. I love to cook my rice or braise my vegetables, like when I cook vegetables, in broth. Or of course, if I'm making soup, I use that kind of thing. But I also wanted to bring in chocolate, because I promised I would bring up chocolate. Collagen is the protein that is in bone broth, and collagen can be also purchased as a supplement, like a powder form. I use that myself. Jessica has found an amazing way to use grass-fed collagen, and I'd like you to tell us about that and how maybe it could help heal your gut.
Absolutely. So collagen is great, because what happens now in modern life is we usually eat muscle meat, right? Like ground beef, chicken breasts. That's great. But we don't eat a lot of the like tendon and skin and things like that people used to eat when they used to eat the whole animal. So we're missing this balance of amino acids. So particularly if you eat a lot of muscle meat, you do want to balance that with broth. So you can cook down the bones, as you said, and eat that. Make sure as often as possible get the best quality, because you don't want a lot of metals in the bones. But collagen protein powder, I was adding it to my smoothies. It's awesome for healing the gut. It's awesome for your skin. It's awesome for your joint pain. And so we started to put it in chocolate. And so we added it to dark chocolate because it's, this is something that's really good for you, and we might as well make it fun, which is also beneficial. There's a lot of benefits to dark chocolate for cardiovascular health and brain health. So we created a little company called Nourrir Chocolate, and that means nourish in French. And because I am really all about, we talked about the elimination diet. Either we can come off as like, oh my God, there's all these horrible foods that you can't eat, and they're all the things you love, which, happened to me. When I first started this whole journey, my doctor was like, well, just give up gluten and dairy. And I was like, what? I'm Italian. Like, I pretty much eat yogurt and pasta. Like, that's all I eat. And I felt so much worse than when I was, eating those things. So you have to come at this with a nourishing approach. So this is a clean, dark chocolate with collagen. The idea is to feel nourished when you eat it. Just like with the elimination diet, I focus on all of the foods you can eat. Yeah. Let's worry less about the foods that are less beneficial to us.
I love that. And to be clear, you are actually a gluten-free eater at this point, correct? You're still a gluten-free eater. Yeah. So that was a long time ago. Yeah. So now I don't eat gluten. I don't eat dairy unless I'm in France for some reason. That is okay. It just happens.
But that's pretty rare because I live in the U.S. And that I come and go with grains. Sometimes they're beneficial for me. Sometimes they're not. but and I don't eat very much sugar, but I'm a total foodie. I mean, just follow me on Instagram. I love food. I cook all the time. I never feel deprived despite letting go of those things.
And that's where the chocolate comes in. So you can have your chocolate and eat it too. Cake and eat it too. But I eat chocolate every single day myself. I don't eat refined sugar. Like, I don't pour it in my cereal. I don't eat cereal, but I don't put it in my coffee. But chocolate I have to have, and dark chocolate, once you develop a taste for it, it's fairly low in sugar, and it is so delicious. So I'm so happy you've come up with this chocolate. I'm excited to try it. Jessica, I'd like people to know how they can get in touch with you, and possibly I'll put links in the video notes as well. So I'll put lots of links in the video notes, but maybe you can share where people might find a functional nutritionist or someone who could help them with this journey.
Well, I think the best place to start is our practice is a little bit busy right now, but that will ebb and flow. So we have a pelvic pain relief program. It's actually called Nourish Pelvic Pain Relief. And that will walk you step by step through the elimination diet that I just described, with specific recipes and all of that kind of thing. So I'll give you the link to that. In general, you can find our work at integrativewomen'shealthinstitute.com. We have both a public and professional areas of those sites. Unfortunately, there's not really a functional nutritionist directory yet. We are working on one of our graduates. So we should have that up very shortly. And if you're looking for a functional medicine physician, a good directory is through the Institute for Functional Medicine, which is something like functionalmedicine.org. But, we have a clinic. If you have a specific question, unfortunately, there are very few functional medicine physicians or nutritionists that are trained in working with pelvic pain. But we have some, and we've trained in quite a few physical therapists, which is great, because then you get both sides of the equation, the pelvic floor myofascial work and the exercise piece. And they have at least ideas and training in nutrition and can help guide you.
Yeah. That's wonderful. Like I said, I've been through Jessica's program. I thought it was wonderful. I am trained in this. I can also help you too. I can, you put my contact information in the video notes as well. I don't do any of the testing, that Jessica's talked about regarding the SIBO or any of these other tests, but I have great basic background knowledge, and I can help walk you through things as well. So all of the graduates from Jessica's program, I think, are extremely well prepared to help anyone. So
absolutely.
Yeah. So thank you so much, Jessica, for being on today, for taking the time, and I'm excited to try out your chocolate. So.
Oh, yes. I will definitely bring you some the next time we see each other.
Absolutely. All right. Well, bye, everyone, and bye, Jessica. Thank you.
Bye. Thank you.